Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is clavicle or collarbone. So today we will discuss about the clavicle. So let us start. It is a long bone. First point, it is a long bone, but it is an exceptional bone in case of what? Because it is placed horizontally in front of the root of the neck, connects between scapula and sternum. So it is a long bone which is placed horizontally and in front of the root of the neck, connects between the scapula and sternum. Okay. Then the main function main function of it is to maintain the gap between the upper limb and trunk. Maintain the gap between the upper limb and trunk. So this is the main function of the clavicle or collarbone. Then strength of the body can be transmitted through the clavicle via coracoclavicular ligament. Coracoclavicular ligament. So strength of the body can be transmitted through the clavicle via the coracoclavicular ligament. Now, difference from a typical long bones. So what are the differences present? Difference that are present from a typical long bone. That is what is the morphological points? Morphological points. First, there is no medullary cavity. Number two, that it is horizontally placed. Number three, that is there are two primary centers of ossification in the body. Number four, it is membranous in origin. Number five, that is sometimes it is pierced by a nerve called medial supraclavicular nerve. So these are the differences that is present from a typical long bone. So first point, there is no medullary cavity. Second point, that is it is horizontally placed, and third point, that is two primary center of ossification in the body, and it is membranous in origin, and sometimes it is pierced by a nerve called the medial supraclavicular nerve. Now what are the features? As it is a long bone, so it has three parts. One is there is two end and body or shaft. Now first end, that is the sternal end or medial end. Sternal end or medial end. So sternal end or medial end, it is more or less rounded and it is directed medially. More or less rounded and it is directed medially, and it is articulates with the manubrium of the sternum. Manubrium of the sternum, and forming the sternoclavicular joint. So what joint is formed here? Sternoclavicular joint. Then for that this end is also called sternal end or medial end. Then number 2, that is the acromial end or lateral end. In case of acromial end or lateral end, it is flat and directed laterally. So it is flat and directed laterally, and it articulates with the clavicular notch of the acromial process. So it is directed towards the it articulates with the clavicular notch of the acromial process, and its form the acromioclavicular joint. Acromioclavicular joint. Then the body or shaft. Body or shaft is divided into two parts. Number 1, medial 2/3, and number 2, that is lateral 1/3. In case of medial 2/3, it has anterior surface of it is convex, and it has 4 surfaces but no border. So what are the surface? Anterior surface, posterior surface, superior surface, inferior surface. And in case of the lateral 1/3, of which the anterior border is concave. Anterior border is concave. And for that, the shape of the clavicle is like the italic letter F. So this is the shape of the clavicle. Now what are the consisting part of the lateral 1/3? We will discuss in this part. Now lateral 1/3. Lateral 1/3 has two borders and two surfaces. Two borders and two surfaces. Anterior border, posterior border, superior surface, inferior surface. Now, first point, that is the anterior border. There, in case of anterior border, there a tubercle is present called deltoid tubercle. Deltoid tubercle present. Number 2, that is the posterior border. There is a tubercle known as conoid tubercle. Number 3, that is the inferior surface the lateral 1/3. There is a trapezoid ridge. Trapezoid ridge or line, and it extends from the conoid tubercle. Up to the lateral end, and in the superior surface there is nothing so much important structures. Then we come to the side termination. Number 1, medial rounded end is directed medially, and the lateral flattened end is directed laterally. Okay. Then the anterior surface of the medial 2/3 is convex, and the anterior border of the lateral 1/3 is concave. The number 3, that is the conoid tubercle and the trapezoid line or trapezoid ridge situated inferior surface of lateral 1/3. Now we will discuss about the anatomical position. How to hold the clavicle? This is the point. The medial 2/3 is slightly forwarded, and number 2, that is the lateral 1/3 is slightly backwarded. So these are the total morphological features of the clavicle or collarbone. So the clavicle or collarbone is a long bone which is placed horizontally, and it is present in front of the root of the neck, which connects between the scapula and the sternum. And the main function of it is to maintain the gap between the upper limb and the trunk or body. For that, our upper limb can easily swing during the walking. Then the strength of the body can be transmitted through the clavicle via the coracoclavicular ligament, and there are some difference present from a typical long bone. First, there is no medullary cavity. It is horizontally placed. Two primary centers of ossification into the body or shaft. It is membranous in origin, and sometimes it pierced by a nerve called medial supraclavicular nerve. Then the features: it has two ends and body or shaft. First of all, the sternal end or the medial end. Sternal or medial end, it is more or less rounded and directed medially. It articulates with the manubrium of the sternum and forming the sternoclavicular joint. For that, this end is also called the sternal end or medial end. Then the acromial end or lateral end, it is flat and directed laterally, and it articulates with the clavicular notch of the acromial process of the scapula and forming the acromioclavicular joint. Then the body or shaft, it is divided into two parts. One is medial 2/3, one is lateral 1/3. The medial 2/3, the anterior surface of it is convex and it has four surfaces but no borders. What are the four surfaces? One is anterior surface, posterior surface, superior surface, and inferior surface. Then comes the lateral 1/3, of which the anterior border is concave. For that, the shape of the clavicle is italic letter F. Then comes to the lateral 1/3. In case of lateral 1/3, there are two borders and two surfaces. There are two borders like anterior border and posterior border, and two surfaces like superior surface and inferior surface. The anterior border, there is a tubercle called deltoid tubercle. The posterior border, there is a tubercle also called conoid tubercle. Then the inferior surface, the lateral 1/3, there is a trapezoid ridge or line, and it extends from the conoid tubercle up to the lateral end. Then comes the side determination points. The side determination are: medial rounded end is directed medially and the lateral flattened end is directed laterally, and the anterior surface of the medial 2/3 is convex and the anterior border of the lateral 1/3 is concave. Then the conoid tubercle and the trapezoid line situated inferior surface of the lateral 1/3. Then the anatomical position, the medial 2/3 is slightly forwarded and the lateral 1/3 is slightly backwarded. So this is our today's topic. If you have any query or any doubt related to this topic, you can comment down in the comment section and ask. You have any question in your mind. Do like, share and subscribe to my channel for supporting me and my channel. And thank you so much for watching the entire video. Do like, share and subscribe.